we're going to look at the blood vessels on the model. So we're going to start with looking at some arteries, but before we do that, I just want to make sure that you're familiar with the difference on the models between arteries and veins. Arteries are usually depicted in red, and veins are depicted in blue normally. Now remember, arteries carry blood away from the heart, and that blood is normally oxygenated, which is why these show up as red. And veins always carry blood back to the heart, and that blood is normally deoxygenated, which is why these vessels are blue. But recall that there's an exception to the arteries are always blue and arteries are always red and veins are always blue rule with the pulmonary vessels. The pulmonary artery is going to take deoxygenated blood away from the right side of the heart to the lungs, and then the pulmonary veins are going to bring that oxygenated blood back to the left side of the heart via the pulmonary veins. So that's the one exception to the rule that arteries are always carrying oxygenated and veins are always carrying deoxygenated. So we're going to start here. We're going to come off, the blood is going to leave the heart via the aorta. We're going to come up the ascending arch, and then we're going to hit this first big branch here. This is the brachiocephalic, the right brachiocephalic artery. It is going to split into the right common carotid and the right subclavian, which is this red one underneath here. Subclavian under the clavicle. The second branch is going to be it's going to come up this left side. This is the left common carotid artery. It's going to bring blood up the left side of the neck. And then the one next to that, the third vessel here, is going to again come along under the clavicle. That is the left subclavian artery. So off of the aorta, you've got three branches. The first one is the brachiocephalic, which immediately branches into the right common carotid artery and the right subclavian. The second branch is the left common carotid, and the third branch is the left subclavian. The common carotid is going to split. If you look up here, it's going to split into an internal and an external, and then we can see that best on this model, where here is the common carotid, and we're going to go up the external carotid or in the internal carotid. That's going to go up into the brain here. So those are the right and left common carotids. Our middle cerebral, we said our anterior cerebral arteries are communicating, and then if you come down here, this here is the basilar artery, and it's going to split into, these are going to continue this way. Those are the posterior cerebral arteries, and then these little branches here that are going towards the internal carotid and the middle cerebral, that is the posterior communicating, this and this. So left and right posterior communicating. Now you notice that there is a little circle here. This is referred to as the circle of Willis. So blood supply to the brain is crucial for your survival. This makes sure that we've got a lot of blood flow going to all the different parts of the brain. Now if we come down from the basilar, so the basilar is being fed by these two vessels here. These are the left and right vertebral arteries. They're going to come up through here. They're going through the cervical vertebrae, through the transverse foramina, through the foramino valley, through the magnum foramen, into the basilar artery. Now, you've got them on both sides. So this would be the right vertebral coming up into the basilar. So those are the blood vessels of the head. We're going to come back here and we're going to continue down the descending part of the aorta. This is because it's going through the thoracic space, this is the thoracic aorta. We are going to have, remember, our pulmonary arteries are going to leave and bring blood to the lungs. So here are your lungs. But remember, pulmonary artery is an artery that's carrying deoxygenated blood away from the heart. So it is going to be a blue one. So your pulmonary artery is here on the left side, and you maybe see some vessels in here for the right side. Then we're going to pass down through the diaphragm, and this first little grouping here of 3, this is the celiac trunk. So the celiac trunk has 3 vessels coming off of it. It's going to have the left gastric, the hepatic, and the splenic arteries. The left gastric is going to go to the stomach, the hepatic is going to go to the liver, and the splenic is going to go to the spleen. This big part of the aorta here is called the abdominal aorta. Underneath the celiac trunk, you're going to have the superior mesenteric artery. This is going to bring blood to basically all of the organs inside of the, here's all your organs, intestines, large intestines, small intestines, etc. It's going to deliver blood to all of those. Beneath here is the inferior mesenteric artery. This is going to bring blood to the lower part of the intestines and things below that. Now, these skinny red vessels coming off of here, these are going to travel down like this. This is the right one, this is the left one. These are the gonadal arteries. The gonadal arteries are going to go to either the testes or the ovaries, depending if you're male or female. Now the abdominal aorta is going to split here. At this split, we're going to go into the right or left common iliac artery. The common iliac artery is going to pretty much immediately split again into the left external and left internal. Can you see in this here? Left internal.
Got it.
And then on this side, the same thing will happen, where you're going to have the external iliac, and you can't see it as well, but there's the right internal iliac. So right external, right internal, and the same thing on the left. From there, we're going to move down into, I'm going to go on this side. This is external iliac is going to transition into the femoral artery, and then from there we'll continue down the leg. I'll grab a leg model in a bit. Now, coming back up here, I skipped over these 2, going to the kidneys. So the kidney is renal, and so we're going to have a right and left renal artery that takes blood to the kidneys. There is going to be, it's not shown on this model, but as you're looking in your book, you'll see a vessel coming off into the adrenal gland, which would be the suprarenal artery. You'd have the same going into the left adrenal gland. You'll have a left suprarenal, but I can't show it to you on this model. And then up here on some of the models, but none that I have currently, you would have the inferior phrenic artery coming through from the diaphragm.
Go.
All right, so we said the femoral artery is coming off of the left, in this case, the left common iliac. No, the left external iliac. It's going to come into here. So here's our leg model, and we're going to come down here. This would be the femoral artery. If we flip the leg over, you're going to see coming behind the knee, here's an artery here. This is the popliteal artery. It's going to, in the back here, you're going to have your posterior tibial artery. And then if we go back to the anterior side, to the front of the leg, here, running along here, this bone here is the tibia. This is the anterior tibial artery. Now you do have, you can't see it tremendously great, but coming off of this here, this branch here, would be the peroneal artery. And that's going to run down this direction. Now let's look at the arm for a second. So here is your arm. We said that coming off under the clavicle was the subclavian. So here is a piece of the clavicle. Coming towards this arm, you would have some of the subclavian. As it gets here in the armpit, this is the axillary artery. We're going to just kind of trace this down, and depending on what part of the arm it goes through, we're going to give it a different name. So here we're going to have the brachial artery, and the brachial artery is going to split into, so again, pinky side versus thumb side. The ulna is over here, the radius is here, so this is going to be the ulnar artery or the radial artery.
Go.
So we were coming down here and we did the ulnar artery and the radial artery, and then between them is the interosseous artery. Interosseous be connecting between two bones, so the radius and the ulnar. And then if you come down to the palm here, this is the superficial palmar arch. And if we flip over to the posterior side, the digital artery is going to come off. It originates back here, but it's going to go off to all of the digits on the back side of the hand.